Intermountain Healthcare is cautiously resuming some surgical cases and procedures. So what does that mean for patients? ABC4's medical correspondent Surgeries talked with an expert at Intermountain for details.
Intermountain Healthcare is cautiously resuming some medical procedures and patient services. We have Dr. Rob Ferguson from Intermountain Healthcare joining us now to explain what does this mean for patients and people coming into the hospital.
So in mid-March, we were asked by the U.S. Surgeon General and advised by the American College of Surgeons to postpone elective procedures with the intent of creating capacity in our hospitals and conserving needed supplies for treatment of COVID-19 patients, as well as to assist with the compliance for social distancing. And those bold efforts had a tremendous impact on flattening the curve. So now, as the governor has removed us from a red risk category to an orange, in addition to caring for emergency patients and intermediate acuity patients with time-sensitive surgical needs, we're allowed to now care for patients that require an ambulatory surgery that are also in the low-risk category.
Dr. Ferguson, so what types of surgeries are we talking about that have been postponed, and maybe you are relaxing that just a little bit?
Surgeries that had been postponed previously were ones that did not have as much sensitivity in the time frame of the surgical management. And so now the procedures that would be allowed are in patients that are not in the category of high risk factors for severe COVID-19 illness in the event they're exposed to SARS-CoV-2 virus, and also patients whose procedures do not require them to be admitted overnight to a hospital or to an extended care facility.
So I imagine some changes have happened now that you are allowing some of these surgeries to happen now at the hospital.
Yes, there have been some changes. We have altered some of our processes to make sure that it's safe for patients. We're still maintaining social distancing and visitor policies as patients are checked in. We also have caution for patients as well as caregivers with regards to appropriate personal protective equipment. And we're making sure that the procedures are safe to perform in an outpatient fashion.
What would you advise patients now if they have an upcoming surgery or they did have to cancel? Do they call their physician or will they be notified?
That's a great question. The majority of patients are contacting their surgeons, and some of our surgeon clinics are contacting their patients that they felt would be a higher priority. The surgeon would be able to then reassess the patient's surgical needs, their current condition, as well as look at the policies and the capacities of the respective facility to determine if it would be appropriate to move forward with the procedure and it would be safe for the patient.
Dr. Rob Ferguson, thank you so much with Intermountain Healthcare, updating us on the changes now happening at the hospital and throughout Intermountain Healthcare system. For more information, just head to our website, abc4.com. Thanks again, Dr. Ferguson.
Thank you.
Coming up, moving from high risk to moderate during the pandemic, what Governor Gary Herbert says the move means for Utah.